Hello, my name is Hannah Riva. I'm a third-year medical student at Paul L. Foster School of Medicine at Texas Tech in El Paso. I am presenting today on the psychodermatology of vitiligo. I'm presenting on behalf of my team that also includes Teresa Yoon, Hamza Malick, also both medical students, Dr. Sarah Martin in psychiatry at Texas Tech, Dr. Adrian Guevara at Epiphany Dermatology, and Dr. Mohammed Jafferany in the psychodermatology division at Central Michigan University. A little bit of background: vitiligo is an autoimmune disease that results in depigmentation of the skin and affects most commonly the highly visible areas of the face and hands. Vitiligo causes significant psychological distress for many of its affected patients. The design of our study was a literature review that was conducted in PubMed using the search terms vitiligo, stress, depression, anxiety, and psychiatric. We prioritized inclusion of articles published within the last 5 years. Some of the discoveries and findings of our research include that vitiligo has secondary psychological effects, including distress concerning body image, depression, and anxiety. Interestingly, conversely, primary psychiatric conditions also occur more commonly in association with vitiligo than seen in the general population. So if I'll turn your attention to the right-hand side, looking at the prevalence of psychiatric disorders in vitiligo patients versus control patients, body dysmorphic disorder, significantly more common in vitiligo patients. Patients with vitiligo have 11 times greater odds of having body dysmorphic disorder than the general population, so above 20% compared with around 2%. Anxiety also significantly more prevalent in patients with vitiligo, depression as well, below that. And then looking at the prevalence of any psychiatric disorder, in vitiligo patients, that's around 75% compared with 25% of the general population. Just a quite stark finding. Below that, have looking at mental health disorder prevalence in vitiligo, looking at odds ratios. We already mentioned anxiety and depression, suicide and intentional self-harm, an odds ratio above 2 to have these conditions in patients with vitiligo compared with the general population. Also substance-related disorders, an odds ratio of around 1.5, and these findings were all statistically significant. So, this kind of goes back to the chicken or egg phenomenon. In some cases, does the psychiatric condition come first, followed by vitiligo, or in others, is vitiligo causing secondary psychological effects, or in many cases, it's some of both, and there's significant interplay between the psychological, psychiatric aspects and the dermatologic aspects. We see this with the development of vitiligo in patients with major depressive disorder, and likewise, the development of major depressive disorder in patients with vitiligo. Both risks are increased. There were some other findings, including association with psychiatric hospitalization is significantly higher risk in patients with vitiligo than in the general population. Also looking at psychological disturbance with disfigurement, that's reported in around 75% of vitiligo patients. So in conclusion, psychiatric disorders are significantly more common in patients diagnosed with vitiligo. This includes major depressive disorder, body dysmorphia, anxiety, and in conclusion, it's critical that we understand the strong associations and effects of mental health on dermatological health and vice versa in vitiligo, so we can better understand and effectively treat these patients accordingly. Thank you so much for your time and attention.